we're okay with this, but we're going to record this webinar. So again, welcome to this day that we have together. We will be done within the hour. So we appreciate you taking this time out. Just a quick overview. I'm sure many of us on this call know these things already after many years of Zoom. But just to remind you that you have different audio settings depending upon how you would like to connect, that you are welcome to chat in or raise your hand if you'd like to speak. We always love hearing voices. We also have the Q&A function. And then if you would like to, you can turn on closed captions by clicking the CC icon. I think Huda, you may have helped in making that live last time. Just want to make sure it is. So you may choose subtitles or full transcript if that supports you in participating today. And a little bit before we dive in about who we are and what we're doing here, and we'll talk a little bit about ourselves just a tad bit in the next slide. But Huda and I, who are your co-facilitators today, are part of the Center for Adjustment, Resilience, and Recovery, or CARE, which is a project of the International Rescue Committee, where we work to really kind of be this like green little box here on this slide to connect agencies and service providers that have different complementary expertise in serving forcibly displaced populations and providing services around mental health and traumatic stress. And so our goal is to really facilitate connections and sharing across these service providers to ultimately better serve and better provide trauma-informed care services to children, youth, and families who have experienced forced displacement. So thank you again for being here and for working with us. If you want to learn more about us, our website is care, C-A-R-R-E, IRC.org, which we can put in the chat and we'll send out to you. But that's not what you're most excited about, I'm sure, nor is this slide. However, you are very lucky that you get to have Huda Shergi, who is one of my wonderful colleagues, our Senior Monitoring, Evaluation, and Learning Officer, presenting today. And Huda, if you want to say hello real quick, I can pass it to you for a moment.
Yeah, thanks, Jess. Hi, everyone. As Jess introduced already, I'm Huda Shergi, Senior Monitoring, Evaluation, Learning Officer, and I do the monitoring and evaluating of the CARE project.
Thanks, Huda. And then I am Jess Dalpy. I am a Senior Technical Advisor for Safety and Wellness here at IRC, and also the Program Director for our Care Center. I'm a social worker and really excited to be here and to talk a little bit more about how we measure our case management work. So as we go into this, we have 4 learning objectives. I told you it would be robust today. Our goal is that when you walk away after today's time, that you will feel confident in describing the components of the benchmarks, including categories and levels of need. You'll be able to apply the benchmarks to any relevant programs that you may have. That you will know how to build your safety and wellness benchmarks into your monitoring and evaluation plan. And then that you'll be able to collect, analyze, and use the safety and wellness benchmark data to help inform, improve, and explain and show the work of your programming. So we're going to dive right in, first starting with an introduction where we're talking about the benchmarks. So what are these things? I keep talking about them. What are they? We say it's a tool, but really the safety and wellness benchmarks, and I call them benchmarks for short, are a case management tool that we hope will be able to help providers document clients' statuses at different points in time in key domains, therefore allowing us to see progress towards these key areas of case management as we're providing services. We designed, which I'll talk a little bit about in the next slide, the benchmarks to apply to case management programs that we talk about as falling under the umbrella of safety and wellness. So those are longer term case management programs that work towards promoting safety and mental and physical health through a lens of empowerment. So this can include many different case management programs that really can support the different needs, the different goals that clients have, and the ways that we help meet and achieve those goals. The benchmarks are a unique tool in some ways, and other ways probably will look familiar, which is a good thing. I didn't want to create something totally brand new and different, but they are unique perhaps in the way that they were developed and also the way that they're meant to be used. So the benchmarks were particularly developed to be used by the case manager as an accompaniment to existing intake and assessment processes that already exist in case management programs, right? We recognize there are a lot of case management programs that most likely have donor regulations that we need to follow. You may already have existing assessment processes, but this tool is really meant to complement. And we do have guidance if you don't already have those processes, where we have suggestions for assessment and for those additional pieces around case management. The other unique piece about the benchmarks is that they were designed to be used without the client present. That is not because we don't want clients to be involved in this process or that we don't want to hear their feedback and have them incorporated and own the process of case management, because it really is for them and at their direction. But really what we wanted to do was create a tool that could be really utilized on the knowledge that case managers have of each of their clients' unique situations to then complete the scoring. We have suggestions for how we can use the benchmarks in meetings with clients, but it's not a tool that we sit and we administer to clients, because we recognize there are so many barriers with the administration of measures of tools when we're working with someone. So we want to emphasize that case management is about the relationship that case managers are creating with clients and vice versa to really meet needs, not about going through a tool and asking question and having response. Those assessments do matter and have their place. However, that's not something that we designed to be a part of the benchmarks. We hope that, and we have seen through our internal implementation at IRC, that the benchmarks can help with the initial assessment of needs, the identification of strengths and resources, the goal setting process in case management, and in providing targeted resources and services as needed and as requested by clients. So I promise I will show you them in a minute, but I want to talk a little bit about the creation of the benchmarks and how we got here. I'm slightly embarrassed to say this, but also proud of this, that took a couple of years for us to fully develop the safety and wellness benchmarks. So there was a very dedicated, brilliant working group that was made up of practitioners, technical advisors, and researchers that spanned over about a year and a half to really create the benchmarks. So it was first rooted in the creation of a unified theory of change for what we mean when we say safety and wellness case management. That's in an appendix, which is in the manual, which I will show you all and will send to you all after this training. And so we wanted to make sure we were talking about the same thing. We had a clear theory of change that helped us understand what we were trying to achieve in case management and therefore what we're trying to measure. Then our goal was to find existing tools. We didn't really want to make one, but what we realized was that there weren't any tools that really captured the unique ways that those of us who provide case management to children and families who have experienced forced displacement, the way that we work with our clients and the way that our clients work with us. And so we went through an iterative drafting process, and then we went through a testing process where we had colleagues develop case vignettes that were based off of composite different cases and clients that they had worked with. And we then went through a testing with the benchmarks. Through that testing, we were able to find that those staff who go through training on the benchmark, so those of you on this call today, if they've gone through training for the benchmarks, they will have high inter-rater reliability, meaning that most people will use the benchmarks in the same way if they've gone through a training. So that's great. That means that if I'm going to use the benchmarks working with a client, I will use it in the same way that Huda will use it. And that's a wonderful thing for us to use as we're looking at standard measurement across programs. And so we are really excited to now be in this phase where we're ready to share it and to hopefully have others use it and see how it works in our programs. So before we take a look at it, I want to talk a bit about how and when to use the benchmarks. So the benchmarks are meant to be used at least 2 points in time. So that is at intake. So when we first start working with clients, and then at case closing. So we have those 2 different points in time that we can compare and look at changes. For the benchmarks and for this process that we went through, the working group, we were in the midst of the initial months of a COVID-19 experience and response. And so we also were noting that the benchmarks could be really helpful to be used at during times of significant change, so like a pandemic or a localized event such as a natural disaster or a change in context. They can help understand those changing needs for individuals based on the contextual shifts and to systematically document changes in stability for groups of clients at pivotal moments in time. When we have longer term case management that spans at least a year, if not longer, we also suggest doing a midpoint benchmark assessment so that you have at least 3 points in time. So intake at 6 months or your midpoint, and then at closing. And if you're providing services for longer than that, every 6 months thereafter. Just so that we can see that progress over time, see those changes over time, right? Changes may not always be in kind of a progression, but we can document those. So I keep talking about the benchmarks, and I promise I will show you them. But before I do, I have just a few slides to talk a little bit more about what they look like. So the benchmarks are essentially a matrix, and they have 15 different categories of support. And these categories of support you can see here on this slide. They were identified by the working group and through a careful review and comparison to the theory of change. And they represent the main areas in which we provide case management services. And so the 2 things that I want you to take away from this slide are that 1, this list is not exhaustive, right? So this does not include absolutely everything that we do with clients through our case management programs. And that is okay, right? Then we would have a list that was probably dozens and dozens of categories long. So again, we really focused in on some of the main categories and areas where there are goals or needs for support that we see in case management. So they're also not meant to be limiting. So they don't include everything. So meaning that you're probably doing other work, but they also are not meant to be limiting so that you can only focus on these things and saying that other goals or other areas of need aren't as important. These are just some of the main areas that we can say are consistently addressed in most case management programs that provide long-term services focused on safety, physical, mental health, and empowerment. So again, we'll talk a little bit more about what it looks like to work with clients around goal setting and around other areas of work in a few slides. So as I mentioned, we have our categories of support on this matrix. And then each category of support has 4 different levels of need. And these 4 levels of need are where clients can kind of fall depending upon their unique circumstance and situation. Each of the levels range from significant to moderate, some, and minimal. So really looking at the client who may be in significant need, they may have immediate or imminent unmet needs in that category, or they might be in crisis in that particular category. Moderate is the client who might have emerging needs, whereas some needs is if a client can meet some of their needs in the category, and minimal is that the client can meet most or all of their needs in that category. The levels each have specific examples of different criteria that might satisfy or might link to those different levels of need for each category. So I'll look at them, we'll look in a minute so you'll know what I'm talking about. But what it means is that the examples for each of the categories in each of the level of need will look a little bit different because we wanted to make sure they were contextualized to those different categories. Every category provides an option for not enough information, right? And as I mentioned on here, these are 15 different areas, and you might not, especially at intake, have information around all 15 of these areas, and that's okay. Or you might realize, I have some information, but I don't have enough to actually be able to make a determination for this category. That's why not enough information is there. It's a link and it's a thought for us to say like, hey, I need to go back and talk to my clients and maybe learn a little bit more about their transportation situation. How are they getting to and from appointments? What can I learn about what their goals are around transportation? Do they have a driver's license? Do they hope to get a driver's license? Right. So being able to link us and alert us to areas where we might need to find out some more information. And then there are a few categories that have an option for a specified version of not applicable. So for example, we will see this example in a few slides. The employment category has an option of not currently seeking employment, right? So that means that one isn't applicable for that client if they're not currently seeking employment or not of the age to legally or ethically work. So I'm going to pause just to see, okay, it doesn't look like we have any questions. So I am actually going to dive us in so we can actually look at them. I know I keep talking about the benchmarks, but now we can put them into practice a little bit. So, oops, sorry. I have a very sensitive mouse and sometimes I click it in the wrong direction. So we're going to go through a bit of an example. So for this, we are currently looking at two categories of the benchmarks. So you'll notice here again on the left-hand side, we have the categories. Right now, we're looking at the categories of community safety and English language skills. And again, each of these has 4 different levels of need, right? So significant, moderate, some, and minimal needs. And under each of those, there are some examples for what it might look like for a client to fall in that level of need as we are making scoring. So not all of these have to be satisfied, right? These aren't meant to, there are not checkboxes there for a reason, right? They don't all have to be present for a client to fall into a particular level of need. They're examples of what it might look like. So, for example, we can look at community safety, right? For significant needs, a client who might have significant needs around community safety might feel unsafe or in danger of being harmed in the community most of the time. They might be facing active ostracization from the community. They might not have any knowledge of available community safety resources or any knowledge of how to maintain safety in the community. Right, so that's just an idea of what it may look like for a client to have significant community safety needs versus looking at a client maybe who has some needs in the area of community safety. They might feel safe in the community most of the time. They might know about community safety resources and being able and willing to access them. And they might know how to maintain safety in the community, and they might be able to do that for most of the time, right? So thinking about those different areas that they might fall. So we are going to go through an example. And I like to paste this case example in the chat just in case you prefer to process a little bit by reading. I will also read it out loud. So here is this example that we are talking through. So imagine that you are working with a client who only speaks Burmese and is able to say no English Burmese to request interpretation, but isn't always understood. However, this person lives in a neighborhood in which nearly all of the community members speak Burmese. Shopkeepers, grocery store staff, bank clerks, even the local emergency medical service and police have Burmese speakers on staff. The client feels very safe and secure in their community, and knows how to access bilingual Burmese and English speakers who can help with transportation and in an emergency or crisis situation. So I'm going to launch a poll. And what I'd like to hear from you all is have this poll up and take a few minutes if you want to kind of read through. I know there's a lot of words on the slide and in this case, but want to know from you all, where would you score this client for community safety? And then question 2 on this poll is, what about English language skills? I see a few responses coming in. Again, you have time, so take your time. I know you're probably thinking through, and for many of you, I would imagine this is the first time you're seeing these. So take your time in reading and processing. Great. Participation. Going to wait just another 30 seconds or so. We will do this one more time. We have another few categories we're going to look at in a few slides. All right, I am going to end the poll. Thank you for those of you who participated, and I'm going to share the results. So y'all should be seeing the results now. So for community safety, seems like the majority of us are thinking the client is somewhere a little bit between some needs and minimal needs. So we're seeing them as generally not having a lot of needs in this area of community safety, but there might be some present. One of us is, or we have a small group of us thinking there might be significant needs around community safety. And then English language skills were a little more varied, right? So we have a lot of different answers, but a lot of them, the most we have seem to be around 1.5. So in between significant and moderate needs. So feeling like there are needs present, but we want to kind of see, seems like maybe we may need a little information here. So I'm going to stop sharing and then we can talk through these a little bit more. So for community safety, right, what we heard from the client said they feel very safe and secure in their community. They know how to access multilingual or bilingual speakers who can help with transportation and an emergency or crisis situation. So when listening to the client, what we're hearing is that the client has minimal needs, right? They feel safe in their community. They know about the safety resources, and they feel confident in accessing them and navigating and maintaining safety in the community. I would imagine many of you are thinking about, well, what if they can't access those multilingual supports, and being concerned about the lack of English language skills that this client has, which is a fair concern, which brings us to English language. So what we're hearing from this client is that they are able to say no English Burmese to request interpretation, but they aren't always understood. That they do have that access to different supports, both bilingual or multilingual supports to help them access services, and that they're sometimes able to get that interpretation. So if we're looking at the benchmarks, that would most closely align with moderate needs. Right, so can communicate a few critical words and phrases, right? No English Burmese. In English or ASL is American Sign Language, and I can tell you a little bit more about how you would know that if you didn't know that by looking at that. This client can request interpretation, but they have varying success and they have that access to different supports. So these are tricky. We made them hard on purpose. Because this is tricky work that we're doing. And I know that we're doing exactly the thing that we don't want to do, which is putting people into boxes. We're looking at clients as holistic, wonderful human beings. But when we are doing the benchmarks, there are a few certain kind of key reminders that we want to think about. And that pertains to how we set goals and also how we are using the benchmarks themselves. So I'm going to move us to the next slide to talk about those. When we are working with clients to set goals, the benchmarks can sometimes alert us as the case managers to categories of support in which a client may have significant needs, right? So for example, you might notice with this client, right, they have pretty moderate needs in English language skills. However, the important thing for us to think about is that these benchmarks are meant to inform goal setting, but the goals should remain client-centered and focused on what the client wants to address. The client that we talked about on the last slide, their goal may not at the moment include learning English. They feel safe in their community, they can navigate it. Maybe their goal is related to transportation, right? And having better access to transportation. Our job is to support them in that goal, or maybe their goal is not even represented in categories. So in many ways, we want the benchmarks to inform goal setting, but we also don't want them to dictate the goals that we're setting with clients. We will talk about a few categories where if a client does score kind of low and have those more significant needs, we do need to respond in some way. Another few helpful tips, which y'all did in the poll, which was fantastic, is to use half points, right? When clients are between levels and you're like, they're not quite a 2, but not quite a 3, that 2.5 is there for a reason. And so you can use that because that helps us have both the differentiation as to where clients are and to see progress over time. And discrepancies. So with that particular example that we went through, I've gone through this a few times with colleagues, and oftentimes when we have scoring for community safety that is lower, right? So saying that there's significant or moderate needs on community safety, it's because what we're maybe worried about is that, yeah, maybe they feel safe in their community, but what happens if they aren't in their community? What happens if they're elsewhere, right? And so when there are these discrepancies between what our thoughts are and our perception is and a client's perception, we want to default to the client's perception. There is a little asterisk here, as I'm sure y'all have noticed. There are times where we would not default to the client's perception, and that is when we know there are active denials of rights or risks to safety. Right. So if we, in that example with the client, if we happen to know that perhaps there were there's recent violence or xenophobia being expressed in that community, right? And the client says, well, I still feel safe. And we can acknowledge that, but we might want to talk to them about what safety looks like and means for them in the context of their community safety. And then finally, is that we want to focus on each category individually. So all of the categories are related, right? And that's why we did that example a few slides ago, where we talked about English language and community safety, right? They are interconnected. And so you might think, this client isn't quite safe because what happens if they leave their community, or what happens if they don't have access to those multilingual supports? That's why we want to look at each one separately. So how does the client feel in terms of community safety versus what are their English language skills? Of course, in life, they are connected and interrelated, but we're trying to look at each of the categories separately. Just a few more tips, and then we'll do one more example. But so these tips are about kind of individuals versus households or community or family. The benchmarks are meant to represent the state of an individual at a moment in time. And so many of the intensive case management programs that exist are focused on an individual who is oftentimes enrolled in services alongside their key family members and supports. And so the ratings for each category are meant to reflect the individual state, but they can also take into consideration the state of their family and support system. When there are different situations between the client and their family or support system, if they are very important to that client's well-being, we want to score the categories with respect to the individual with the highest level of need, right? So we might be changing that scoring based on the other people involved in that client's life. Finally, on this slide, and I do see there's a question, so I'll get to that. But in cases in which the individual being served is a caregiver, or if there are minors in that individual's family or home, there are two categories, relationship safety and mental health, where we have separate examples for the criteria for minors and youth and adults. And so where there are children in the family or the client that we're serving is a caregiver, we want to also take into account and score the corresponding categories for the children in the home. And again, that would be scored with respect to the child or the individual with the highest need. And the same goes if the main client that we're working with happens to be a minor. We also want to take into account their caregiver's well-being and state. Let me check out. Great question. Oh, and hi, Jill. Is there ever a concern that a client will not respond frankly if it is perceived that their answer could affect their access to services? It's a great question. And I think there's always a concern that clients won't respond, won't feel comfortable responding fully and disclosing all of the information if they feel like their ability to engage in services is dependent upon that answer. I would hope as we're setting up case management programs and with the benchmarks, right, we didn't design these to be used as a screening criteria to screen clients out of services, but to help us pay attention and to measure the progress that's being made as we are delivering services. And so I think that's something to take into consideration and to think about as we're engaging in services with clients and explaining what the assessment process for case management looks like, right? Why are we assessing? That in assessment, there aren't any wrong answers, right? We're gathering information so we can better support the client. But yeah, Jill, if you'd like to talk more, let me know if we can provide some more clarity or response on that. But a good question. So we have one more example that we're going to go through, and then I'm passing it over to the wonderful Huda, where we can talk a little bit more about monitoring. Oh no, I lied. I'm going to talk a little more about the resources, and then we get to hear from Huda. But let's go through this example. Again, I'm going to paste in the chat, just if you prefer to read. Oh, never mind. I must not have hit copy. Don't read that one. It's the same one. I mean, you can read it, but it's probably not going to be super relevant. This is the right one. This client, we are working with a client who has a job for which they have no paid time off or benefits. They are usually able to work enough hours to pay for rent and are able to supplement their food purchases from a local food pantry, but sometimes they fall behind on their bills and other essential needs. The client shares with you that they sometimes have a hard time finding a ride to work and are working under the table as they don't have employment authorization. The client tells you that their employer sometimes forgets to pay them and will not always pay them the same hourly wage for the same work. But the client tells you that they're okay with that because things like that happened a lot back home. They say the employer is very kind and will sometimes buy pizza for them when they work really long days. So we have here on the screen two different categories for employment and rights and resources. So just like we did last time, I'm going to launch a poll and we'd love to hear from you all. Where would you score this client for employment and for rights and resources? Great. I see some responses coming in. Maybe another 30 seconds or so. Great. All right, I'm going to end the poll and share the results. So you're stuck between 1.5 and 2 for employment. We're thinking the client is somewhere, we need like a 1.75, it sounds like, based on the responses here. And then rights and resources, we are pretty scattered. So we have significant needs, moderate needs, and not enough information. So I'm going to stop sharing and we can talk through these briefly. So y'all did a great job, right? I think for employment, we're somewhere around 1.5, right? Because that client, we're not too sure what their employment situation is, right? Which I'm kind of sensing from the responses for rights and resources. We know that they do not have employment authorization, that they do face some barriers. And so we're just paying attention to those pieces. So, right, 1.5, 2, we're seeing some moderate needs that are coming up here. I think based on what we saw with the responses for rights and resources, we're trying to figure out what's going on, right? We're not so sure if the client's rights are being violated, right? If maybe they are in an exploitative employment situation. I think was kind of seen as from your responses, right? Some of us thought moderate needs, some significant. And what I would say for this one is, right, that there's not enough information. We may need to learn a little bit more, talk to the client a little bit more about how they were hired, what their job is supposed to be, make sure that they know what their rights are, even without an employment authorization document. What rights do they have in the workplace, right? So we might need to go back and gather a little more information. This is always a perfectly fine response. So great job, everyone. Last few things that I will share before I pass to Huda. So we have one final category, which is our self-efficacy and advocacy category. Because a core piece of the work that we do is centered around supporting our clients' abilities to advocate for themselves and their sense of self-efficacy in that. This one is unique because what you are instructed once you complete all of the other benchmarks to reflect on the client's sense of self-efficacy and ability to advocate for themselves across all of the categories. So this one, you're actually thinking about all of the others as you're making this determination for self-efficacy and advocacy. So that's where this one is a bit unique. Finally, before we go into monitoring and evaluation, we have resources for you, which I will share out after this webinar. So we have a manual, which I will just quickly pull up to show you all. We have the benchmarks themselves in one full tool, so you will have access to this. And then we have a manual. The manual has a good amount of information in it around how we created the benchmarks, definitions, concepts, how to use them. And then each category of support has its own page. And on that page, we have things like key definitions for different terms, suggested assessment questions. For food security, this comes from the Household Food Insecurity Access Scale. And then because food security requires a response, we have suggested response actions. So if a client has significant needs, we want to make sure we are providing them with food immediately and resources for obtaining food for the rest of that day or week. Which that is followed by a page that has just that particular benchmark in it. But this is the manual. Again, you will have access to this. We'll make sure you all have it. It'll also, we don't have it live, I think, on our website just yet, but we'll also have it on our website. But wanted to make sure that you all knew there are other resources that we hope that you can go through after this training. But with that, I will pass it over to Huda for talking about our M&E plans.
Thank you, Jess. So as Jess just mentioned, I will be talking to you about how you can incorporate the benchmarks in your M&E plan. So to start us off, I just wanted to see if you know what an M&E plan, and we're going to launch our first poll, and I'm going to ask Jess to help me out launching our first poll of this section, to ask you if you know what an M&E plan is. So is it a plan that combines costs of all tasks that the project must fulfill? Is it a plan that announces the project, describes it, and solicits bids from contractors? Is it a plan that guides the collection, management, analysis, and data through the life of the program? Is it a chart in which a series of lines shows the amount of work done in certain periods of time? Or do you really not know? And that's perfectly okay. Okay, I'm going to end the poll and share out the results. Looks like most of you said a plan that guides the collection, management, analysis, and use of data through the life of a program. That's wonderful, because that's exactly what an M&E plan is. So you can use it throughout the life of a program or the funding period. So having an M&E plan is really important, that it can help you ensure that your program is high quality, equitable, and effective, and can help you understand how your program's performing, who it's reaching, and notice any disparities in outcomes amongst your target groups. So in terms of what an M&E plan encompasses, M&E plan components are your expected project results, what data will be collected and by whom, when and how to monitor and evaluate the project, how your data will be stored and protected, the resources needed to carry out your M&E activities, also your budget, who will be involved in the process, how your data will be analyzed, and how your data and your project learnings will be shared and how they'll be used. So building benchmarks into to build your benchmarks, to incorporate your benchmarks in your M&E plan, you can use them to measure your outcomes or your objectives. So the first step is to define your objective and outcomes. And to be able to do this, you need to ask, what is the end goal of your project? And what is your project hoping to achieve? So you can then enter all of this information into a log frame. So a good log frame is the foundation of your team's monitoring and evaluation plan. So I'm going to launch another poll and ask you, do you know what a log frame is? And I will ask my colleague Jess to help me launch this poll to see if you know what a log frame is. So perfectly okay if you do not know what it is. Okay. Good number of participants. Give it 1 5. Okay, looks like we have some yeses, a kind of, and some not at all, which is great because I will tell you what a log frame is. So a log frame is a table or matrix that summarizes the key elements of the project strategy. So you have your project objectives, your intended outcomes, planned outputs, and major activities. It outlines the indicators that'll be used to measure progress and the sources of data, also known as means of verification, and any assumptions necessary for your project's success. So log frames can really help you and your team articulate and remember what you intend to achieve. So in terms of indicators, your M&E plan should include donor-required indicators and any other indicators that are needed to measure and communicate the results and enable analysis and reporting of your results. So make sure to develop realistic targets for each indicator and determine any data disaggregation categories in line with data protection rules and with any real possibilities to collect it. And ideally, your indicators should be smart. So I'm going to launch another poll, or Jess will launch another poll to ask you, what does SMART stand for? Does it stand for specific, measurable, accessible, relevant, and targeted? Specific, measurable, attainable, relevant, time-bound, sustainable, measurable, accountable, relatable, targeted, sustainable, measurable, attainable, relatable, time-bound. So I know this is a tricky one, a lot of similar words. I'll give it another 10 seconds. Okay, I'm to end the poll now. It looks like most of you said specific, measurable, attainable, relevant, and time-bound. So let's see. It looks like you were right. It is specific, measurable, attainable, relevant, and time-bound. So, oh, sorry, my keys are also sensitive. So we're going to start talking about a case study that uses benchmarks. And that is Salamati Rohi, which is a 1-year multi-site mental health and psychosocial program for Afghan clients at IRC. It began in June 2022. The project model is twofold. It involves trained peers from the Afghan community who provide skills for psychological recovery, also known as PR, which is an evidence-informed intervention that aims to help survivors gain skills to manage distress and cope with post-disaster stress and adversity. And mental health coordinators who provide specialized mental health services and train staff and community providers in recognizing mental health signs and symptoms, as well as referral pathways, and how to provide culturally responsive, evidence-based, and trauma-focused services. So the project's aim was to ensure that children, youth, adults and families receive culturally responsive, evidence-based, and trauma-focused services to be able to prevent the long-term negative impacts of traumatic stress and forced displacement. So this is the project's theory of change. I know this is a busy slide and a lot of information, but I would like to just point your attention to the objective that which we used to, we use the safety and wellness benchmarks to measure. And our objective, as you can see, is related to the project aim and use the benchmarks to measure it. So once we created our theory of change, we developed a log frame. And again, log frames can really help you and your team articulate and remember what you intend to achieve and what you'll measure, and see if you have achieved what you sought out to achieve. And so pictured here are your columns of your log frame, which includes the results, the description of your results, indicators, means of verification, also known as source, and assumptions. And so pictured here is just the objective. And if you may recall, it's the exact same description that was in the theory of change on the previous slide. And so as you can see here, our three indicators use three different benchmarks to be able to measure our description. So our objective. So we used mental health, we used social support. Sorry about that. Again, those keys. Social support and self-advocacy. Self-efficacy and advocacy. And so as you can see here in the means of verification, we use the safety and wellness benchmarks to measure all of these. And we use ETO to store them, which is the internal database that we use at IRC. And as you can see here, we have an assumption that if clients can meet their basic needs through other case management services, then they would be able to, then Afghan children, youth, and families would be able to prevent and manage mental health conditions and symptoms. So once we built the log frame, we built an indicator matrix, which is very similar to the log frame, except with a couple of components. So there is a calculation in the indicator matrix. There is disaggregation and a frequency of data collection. And so as you can see here, the left quadrant is very similar to the log frame, identical, where you can see the description of your objective and your indicators. But then you see the calculation that we said that any score of 4 would, that if clients had a score of 4, then we know that we had reached our objective. And so in mental health, support system, and self-efficacy and advocacy. And we disaggregated our data by gender and nationality, and we measured it at baseline and at case closeout. So you'll want to make sure to define how you want to calculate your indicator the way that we did. So now I'll talk about collecting and analyzing and using safety and wellness benchmark data. So benchmark results should be entered in a database in real time if that's possible for your organization. I know in many cases that's not possible in more lower resource settings, or if you just don't have the infrastructure, you could use an Excel spreadsheet. They're in the same manner to track your benchmark scores, always ensuring to keep client information stored in a secure manner, of course. We can share in a follow-up email a data collection tool, that sample data collection tool that we created, which is pictured on the slide. On the left quadrant here, you can see process information. And on the right, you can track your benchmarks, and the different benchmarks are in each column, starting from column D. In terms of analyzing your data, there are many ways that you can look at your benchmarks for So you can look at them in aggregate trends per benchmark category. So you can look at numbers or percentage of clients whose score increased, stayed the same, or decreased. You can also look at the percentage and numbers of clients who scored a 4 by different demographic groups. In this example, we disaggregated by gender. Or you can look at the mean initial scores versus the final scores across all clients. And you can visualize it in many different ways. You can visualize it in a bar graph or in a line graph as shown on this slide. So we highly recommend meeting with your team to be able to review the data and develop a plan to be able to take action, also called data review meetings. So they are a really good opportunity to assess data quality and determine the extent to which you're achieving your results and identify any challenges that need to be addressed. This can be 10 to 15 minutes of an already existing meeting, or you can set up a separate meeting to review and to take action. So the steps are, you can select a few specific results, dedicate time to review the data, then come together and review it together, and develop an action plan. So during data review meetings, you can look at data quality. So to what extent does the data look accurate? You can look at your outcomes, ask to what extent are you achieving your results? Are there any trends? You can also identify challenges or risks. Is there anything that needs to be addressed? So we have a data action template that we can also share in a follow-up email, so don't worry. This is kind of what it looks like, where you can write down any action steps that you've identified to follow up on and show your results. So we're going to loop back to our case study now, talk about Salamati Rohi and the data review meeting that we conducted. So during Salamati Rohi's first data review meeting, staff were invited to reflect on the data they'd been collecting for the past 4 to 6 months. And we were taking a look at the benchmarks, and we were able to see some differences between the initial and final benchmarks. We had a sample of clients that completed both initial and final benchmarks, and we saw that the number of clients that scored a 4 changed across all 4. So for adult mental health, they went from 1 client scoring 4 in the beginning to 10. Similar to minor mental health, 1 client started at 4 and 4 ended at 4. And then support systems, 4 clients scored 4 in the beginning, and 7 ended up scoring 4 at the end. And with self-efficacy, only 2 clients scored a 4 at the initial, and then 6 scored a 4 on self-efficacy. And so we asked staff to reflect on these results, and via a Jamboard, sticky notes, they said that they weren't generally surprised since they were the ones entering the data, but they did note that they wanted to make a plan to be able to record benchmarks better when clients ended services, and that there were some challenges in completing that when client services ended. And so I will pass it back to Jess to be able to wrap this up.
Thanks so much for that. And thanks everyone. And we have just a few minutes, but bringing this back home to how we use the results, right? Our goal with the benchmarks is to be able to use them to identify trends in the services that we're providing, to be able to identify best practices as we're seeing progress being made, right? So we can look at that evidence through the benchmarks as to what's going well and what we can do better. As we're looking at trends, we can also use those trends and that data to apply for funding, right? To say, hey, we are recognizing a need and we have the data to back this up, or to advocate for resources. One of our offices went through and used the housing benchmark in particular to look at all of their clients when they exited case management. And this case management program did not have direct assistance funds for housing support, and there was an overall lack of affordable and available housing within that particular location. And so they used that to then advocate both locally within their office for more funds and with funders and policymakers for the need that was in the community. And it can help us improve services, right? Where we might see regular, consistent kind of changes or areas for support that need to be improved in our work. So we hope that they can be used in many different ways to help understand individual cases and the success, but then also aggregate data across our programs. And with that, I know we have one question in the in the Q&A. And hi, Jill. Jill's asking, how do we use or adapt the use of the benchmarks if we work collaborative on service delivery with another agency? That is a great question, Jill. I think that would be having a conversation, but with that other agency and thinking about what it is that your agency is working towards. Maybe you can work together, or maybe you are tracking particularly the services and the categories that you're working on. We're also happy to always have follow-up conversations with anyone. So you can reach out to us, get in touch with us via our CARE website. So we are here and happy to have ongoing conversations about what it might look like to put the benchmarks into practice. So thank you all so much. I know we are 1 minute over time. We appreciate you being here. If you have a moment, we request that you just take our feedback survey, but we will also email that along with other resources out to you all. But thank you so much for the work that you do and for spending this time with us. We really appreciate it. And we hope you have a great rest of your day.
Thanks, everyone. Have a good rest of your day. Bye.